Hi, Ms. Brown. So today we're going to continue our postpartum maternal teaching. I'm trying to tell you a few things that you're going to expect, okay? You might experience pain known as afterbirth pains. This is caused by the uterus constricting after the delivery. Your uterus is trying to go back to its normal size, which is usually the size of a lemon. The pain usually goes away in about 3 to 5 days. However, if you feel that you can't handle the pain, it is okay to take ibuprofen, Tylenol, baths, and a warm pack can also help ease the pain. Your bowel movements, you're going to expect them to be delayed after your postpartum delivery. Hi, Ms. Brown. So today I'm just going to be going over a couple of patient teaching things that I would like you to understand prior to you leaving the hospital. I just want to let you know you might experience pain, known as afterbirth pains. This is caused by the uterus constricting after delivery. Your uterus is trying to go back to its normal size, which is usually the size of a lemon. It usually takes about 3 to 5 days. If you feel that you need to take something for the pain, you can. You can take ibuprofen, Tylenol. You could do baths. A warm pack can also help ease the pain. It is normal that your bowel movements may be delayed. It is okay to take a stool softener, and please make sure to stay hydrated. The reason for your bowel movements being delayed is due to the decreased abdominal tone after being pregnant. If you developed any hemorrhoids, you can also take warm baths, and the stool softeners may also help with that. If you notice that you're having any sweating, that is normal. It will decrease. Let's see here. Please monitor your urine output. Monitor that you are, in fact, being able to void. If you notice that you're having swelling, we can rest. You can lay down, elevate your legs to your heart level. That will help with the swelling. It is normal for you to still have swelling after delivering your baby. We can also monitor the salt that you're having in your food. But however, if you do notice that you're having extreme swelling and pain, redness, or tenderness, please call your provider immediately. We want to rule out a possible blood clot. In regards to your menstrual cycle, it usually takes about 6 weeks after birth for it to return. If you're breastfeeding, it can take additional 2 weeks, so a total of 8 weeks. However, you can continue your regular exercise, maintain a balanced, healthy diet, and make sure you stay hydrated. Get enough sleep. Sleep and rest are very important. Take advantage of the time that your baby's sleeping for you to take a nap. It is important that you do not have any sexual intercourse or insert any tampons for 6 weeks. We want to make sure that the doctor gives you the okay for you to resume those activities. The doctor wants to make sure that everything has healed properly. Breastfeeding. We talked about breastfeeding positions in our last meeting. However, I just want to remind you that breast engorgement is common. Your breast will feel heavy and overfilled. It is normal. Do not discontinue breastfeeding. Feed your baby at least every 1 to 3 hours. Even if your baby is sleeping, make sure you wake your baby up for a feeding. You can also apply a warm, moist heat right before the feeding to help with the circulation. It is important to make sure that your baby is latched on and positioned correctly, which we talked about the football hold and the cradle hold. If you're going to decide to do the tube pump, you can, but you should try to have the same schedules when your baby would normally feed at home and if you have to return back to work. This will help with the breast engorgement. Once again, plenty of fluids, avoid hydration. I want to talk to you about mastitis. It is an infection that you can get. If you have it, you will experience swelling, redness, tenderness, pain around the breast. It usually affects the upper part of the breast towards the armpit region. If you develop any swelling of the glands, fatigue, headache, flu-like muscle aches, a fever or rapid pulse, you can contact your provider. Strategies are do not discontinue breastfeeding. It is okay to continue breastfeeding your baby. You can rest, increase your fluids, take medicines for the pain. If you develop an abscess, you may need to have it drained. If your doctor may prescribe an antibiotic, it is okay to take your medication as well. You may develop signs of postpartum depression. If you feel this way, please reach out to us. We do have resources available for you. Now let's talk about your newborn. Your baby will communicate with you through his or her cry. Your baby will be either fuzzy, irritable, just want comfort or is hungry. That is the way of communicating. In regards to bathing, do not leave your baby unattended in the tub. Your baby only needs about 2 to 3 baths each week. Sponge baths are recommended until the umbilical cord falls off. Please make sure you clean one area first. Example, clean the baby's face and body before using the washcloth to clean the diaper area. When you change your baby's diapers, make sure to keep your baby on his or her back. Remove any clothing that inhibits access to the diaper. Remove soiled diapers. Lift your baby up gently and you can clean the bottom. If the area is red and inflamed, you can soothe it with diaper ointment, such as Desitin. Okay, do not leave your baby in the sunlight. You can protect him or her from exposure by covering him or her with clothing, hats, light blankets, or umbrellas. If you need to take your baby's temperature, make sure to take the temperature rectally, orally, or axillary, which rectal means in the bottom, orally in the mouth, or under the armpit. Umbilical cord care. This is an important part. Your newborn's umbilical cord was clamped and cut shortly after they were born. The cord clamp can be removed by the nursing staff when the cord has dried. The remaining cord should fall off and heal within about 1 to 3 weeks. If you notice any drainage, please report it to your provider. Make sure that you fold the diaper down and not cover the area. It will help it dry and heal more quickly. If there's any redness or swelling of the umbilical area or the drainage, please make sure that you reach out to your provider. Your newborn will have 6 or more wet diapers in 24 hours, and that is normal. Your newborn's first bowel movement, you're going to expect it to be sticky, green, blackish, and tar-like. It is normal. If you're going to breastfeed your baby, you should expect at least 3 to 5 stools each day for the first 5 to 7 days. If you're formula feeding your baby, you should expect the stools to be firmer and grayish and yellowish. It is normal for a newborn to have 1 or more stools each day. He or she may even miss a day or 2. Okay, Mrs. Brown. If you have any questions, please reach out to us. I will send you an email with all this information. And once again, we have talked about breastfeeding positions, but if you have any questions, please go ahead and reach out to me. Thank you.